we'll cover that regarding the medical coding. I think all of you know little bit about the medical coding. What is this? What are the job opportunities? Because nowadays, from the last 3 to 4 years, there are huge opportunities in the medical coding. But there are some certain criteria what you need to maintain for be a international medical coder. And one interesting thing is that if you will be a certified medical coder, then you can do your job from your home also. So you should have that certification, and as well as you should have the knowledge of working. Obviously not from the beginning. Some company they allow it for the beginning, but for some companies they will start after 1 year of working. But I have seen many women, they are working in the medical coding for a long time. Those who have the certification in the medical coder of the APC, and they are working for a long time, and they are working from the work from home. So now just little bit I want to share about the Pharmagen DRX. You know that we are trying to upskill the students that to improve their skill. So that's why this is one upskill program, and in upskill program today we'll cover about the medical coding. So medical coding is the process of translating healthcare diagnosis procedure, medical devices, and equipment into the standardized codes. These codes are drawn mainly from the ICD, International Classification of Disease, CPT, current procedural terminology, HCPCS. Okay, so these are the different codes. But today I want to introduce with you with our speaker. So she is associated with the medical coding from the last 7 to 8 years, and she is a AAPC certified medical coder from 2020. Have the expertise on ICD, CPT, HCPCS. Now she is in Oman, but she is working for many companies from the last some year. So this is very important. This will be very important for all of you to know about the medical coding directly from our speaker Veena KV. So now directly to over to ma'am. So I will request and I will welcome ma'am to today's new episode of the medical coding, and please share some information regarding the medical coding, those that will be helpful for the students for making their career. Thank you. Over to ma'am. Okay, we'll wait more 1 to 2 minutes for joining others, because there we are receiving many invitation from the others for joining this, and then ma'am will start, and obviously we'll share with you regarding all the things about the medical coding. So we'll wait for 2 minutes, and then ma'am will start.
Hello, good evening all. Can you hear me? Hello,
Good
hello.
evening. Yes, you are audible.
Can you hear
Yes,
me?
ma'am. You're audible. You're audible. You can start, ma'am. Yeah, please, ma'am. Over to
Oh,
ma'am.
okay. Yeah, okay, okay. I'm Veena, APC approved medical coding instructor. And what is medical coding or clinical coding? Medical coding or clinical coding? Medical coding is the process of patients, diagnosis, diseases, and procedures procedures such as surgery, investigations like X-ray, CT, MRI, and blood investigations. These are investigations. These are converted to alphanumerical or numeric code format. This is medical coding or clinical coding. Clear?
Yes, ma'am.
Patient diseases, diagnosis and symptoms, procedures like surgery, investigations such as blood investigations, X-ray, CT, MRI. These are converted to alphanumerical or numerical code form. This is medical coding or clinical coding. Okay, let me share the screen. This is medical coding. Medical coding is a transformation of healthcare diagnosis, procedure, medical services, and equipments into universal medical alphanumeric or numeric code format. You clear?
Yes, ma'am.
This is 3-month course. This is 3 months course. Who can join medical coding? Both life science and non-life science and life science graduates. This is a 3-month course. Who can join medical coding? Both non-life science and life science graduates. And we need basic knowledge of anatomy terminology. So we will start with that, then cover medical coding subjects like ICD, CPT, and HIPICS after anatomy terminology. Hello?
Yeah, ma'am, you're audible.
After
You're audible, ma'am.
after completing the course, it's recommended to take the CPC exam. CPC exam conducted by AAPC. AAPC means American Academy of Professional Coders. This exam is online with 100 questions and no negative marks. You will need to score 70% to pass. The certification is internationally valid, so don't need extra certifications like DHA, MOH, or other templates.
Ma'am, can you please show that diagnosis and procedure part? Can you please explain that part again?
Yeah, the introduction. What is medical coding? Hello,
Sorry, ma'am.
can you repeat?
Can you please show the slide of the diagnosis and procedure, and can you please explain that once again?
Yeah, this is example of ICD, CPT, and TPICS codes. Medical coding syllabus has 3 subjects: ICD, CPT, and TPICS, HCPCS. Is a medical coding syllabus. What is ICD? ICD means International Classification of Diseases. This is completely disease or diagnosis coding. Then next, CPT. CPT means current procedural terminology, current procedural terminology. This is procedure coding. This is completely numerical code format. Next, next is sorry, HIPIX. HIPIX coding is medical equipments. We are coding HIPIX coding. HIPIX example. Then Q is a alphanumeric code. How to convert how to convert medical coding. Then here for an example, patient admitted to the hospital with abdominal pain. Doctor diagnosed it as appendicitis. Doctor performed an appendectomy procedure. Here what is the diagnosis code, you know? Hello.
No, ma'am.
Ma'am, your skin is not visible.
Not visible. Now?
Ma'am, can you
Now?
please share PPT? Then it will be very helpful for the student. So they are not visible. The PPT is not visible.
Mm. Now, sir?
Yeah, now it is visible. Yeah.
Yes, ma'am.
Yeah.
Yes.
Yeah, okay. Here, how to convert medical coding. Here, patient is a condition. Patient admitted to the hospital with abdominal pain. Doctor diagnosed it as the appendicitis. Doctor performs a appendectomy. You know what is the diagnosis code, you know? Here, diagnosis is appendicitis. Here, patient diagnosis is appendicitis. So, now we can convert to ICD code. Appendicitis K35.80. It's very simple. Appendicitis now we convert it to ICD code K35.80. Then appendectomy is a procedure or surgery. This is CPT code. ICD code completely alphanumeric code. Then CPT code is completely numerical code. Do you have any doubts on how to convert medical coding?
How can we convert that? How to know that appendicitis ICD code is K35.80? How can
0.80. You can find them alphabetic index.
sorry, ma'am?
You can find them. This ICD book is a two-part alphabetic index and tabular index.
Okay, so we need to find any means any of the code from this among these three of the
Yeah.
book.
Yes. Here you can find them. You can find them ICD book.
Okay, ma'am.
Okay. Then appendectomy is a procedure or surgery. You can find them CPT. Here
Yes, ma'am. Clear.
we need medical coding has only three subjects: ICD, CPT, and HIPIX. ICD coding we can code only diseases, diagnosis, and symptoms only. Then CPT codes we are converted to procedures, surgery, investigations. Then HIPIX code completely alphanumeric code, only medical equipments. It's medical equipment, medicine, syringe, glucometer, wheelchair, each and everyone. Okay. Hello.
Ma'am, the after that CPT procedure, the last, the process or whatever you are saying, it's not clear to me. I cannot understand that last after diagnosis, ICD is diagnosis, CPT is procedure. The last one is not clear to me.
Yeah, last one is HIPIX. This is HIPIX. HIPIX means HCPCS. This is code only medical equipments. Medical equipments like medicine, syringe, glucometer, and wheelchair. Hello.
Thank you, ma'am. It's clear now.
Okay. Then we need basic knowledge of anatomy terminology. This is a medical term. This is a medical term. Hyperthyroidism. What is hyper? Hyper means excessive. Thyroid is a gland. Ism is a condition. Hyperthyroidism. What is hyperthyroidism? Excessive production of thyroid.
Thyroid hormone.
Excessive production of thyroid. We need only basic knowledge of anatomy terminology.
Yes, ma'am. It's
Do you
clear.
need other example? Let's wait. Hello, can you see this?
Yes, ma'am.
This is medical terms. These are important 7 elements of medical terms are root, suffix, prefix, combining vowel, and combining form. These are important elements of medical term. It's very simple. Then first element will be root. Root is the foundation of the term. Suffix means word ending. Prefix, word beginning. Then combining vowel. We are usually using O. There are no meaning of combining vowel. It's only connect root to root. So only connect root to another root or root to the suffix. There are no meaning of combining vowel. Next, combining form. Combining form is a combo. Combination of the root and combining vowel. These are important medical terms, important elements of the medical term. Clear?
Yes, ma'am. Clear.
And how to convert medical coding? Let me give you a simple sentence, simple example. This is hematology. Hematology. This is a medical term. This is a medical terminology. Then this hemat is a root. O is a combining vowel. Logy is a suffix. Hemat means hemat root or combining vowel and logy is suffix. Here there are no meaning of combining vowel. It is only link root to the suffix. And what is hemat? What is hemat? Hemat
It
means
is
blood. Hemat means blood. Logy means study of. Hematology means study of blood. Clear?
yes, ma'am.
Next, another term, electrocardiogram. Electrocardiogram. All medical terms have one or more roots. All medical terms have one or more roots. Here, what are the roots? You know? Hello?
Two, ma'am.
Here, what are the roots? The elector
And
and cardi.
cardi.
Yeah, elector and cardi. Here, two roots or two. Here are two roots and two combining vowels. Once again, there are no meaning of combining vowels. It's only connect root to another root or root to the suffix. Clear?
Yes, ma'am.
Here, elector, combining vowel, and cardi, again combining vowel, gram, suffix. What is elector? Electrocardiogram, ECG. What is elector? Elector means electricity. Elector means electricity. Cardi means heart. Gram means record. Gram means record. What is electrocardiogram? Record of electricity in the heart. Clear? Elector means electricity. Cardi means heart. Gram means record. What is electrocardiogram? Records of electricity in the heart. ECG. Clear?
Yes, ma'am.
Hello. Okay. Then another term, gastritis. Here, here, root is gaster and suffix is itis. Root is gastric and itis is suffix. Here O is absent. We are usually using O. Here itis. Here itis suffix is itis. Here using another vowel. So O is absent. Gastritis. Gaster means stomach. Itis means inflammation. What is the meaning of gastritis? Hello? I can tell you that. What is gastritis? Gastro means stomach. Itis means inflammation. What is gastritis? Inflammation of stomach. This is medical terms. So you just read medical terms. We need only basic knowledge of anatomy terminology. Do you have any doubts now in medical terms?
No, ma'am, no doubt.
It's very simple now. Do you have any doubts in medical coding, medical terms? Hello? Do you have any doubts in what is medical coding and medical coding syllabus? Hello?
No, ma'am, no doubts in medical coding syllabus, but what are means how to give this exam or what are the course details and all if you can
Yeah.
clarify.
Okay, this is okay, that's fine. This is the 3 months course. Eligibility, any graduation, both life science and science graduates.
From where
Okay,
we can apply that.
both science and life science graduates. After complete the course, it's recommend to take the CPC exam. After this is 3 months course, after the 3 months, you must attend the CPC exam. What is CPC exam? CPC means Certified Professional Coder. CPC exam conducted by APC. APC means American Academy of Professional Coders. This exam is completely online with hundreds questions and no negative marks. You will need to score 70% to pass. This certification is internationally valid. So don't need extra certifications. What is extra what are the extra certifications? DHA, MOH, hard. Without CPC. What is without CPC? It's a non-certified coders. If you pass the CPC pass, you are a certified coder. Without CPC. Without CPC means non-certified coders. You can still join in MNC companies.
Okay, thank you, ma'am. So I think student have some confusion regarding the AAPC certification. So I will make some summary on this that how you can prepare and how we can go for the AAPC certification for the CPC. So now please check this PPT. 1 minute just.
Then after the 3 months course, you can attend this exam registration. You can
Ma'am,
do
from
exam
where we
registration.
will be doing this course?
I didn't clear that.
From where we will be doing this course?
From Kerala, Sigma Medical Coding Academy.
Okay, ma'am.
On 2019.
Ma'am, when, how we are going to do this course? That I am asking.
Okay. Can you repeat that?
From where
Or
we can do this course? This 3 months course we have to do from somewhere. So from where we will be doing it?
Okay, hi Sweta. I'm giving you the answer. So before that, just I'm telling you that. So I think some I'm getting some message that some students did not hear well about the APC certification. What is the APC certification? So ma'am told, and I'm just briefing that. I don't know why the PPT is not showing in the presentation. So I'm trying to present that. APC, that is basically the APC is the American Academy of the Professional Coders, and they have the given the CPC certified professional coder. So there is a huge syllabus on the certified professional coder, and as you know that this is the online examination, you will get the 4 hours to complete this, and there will be the 100 MCQ. And one important thing is that you should score 70% to get this certification. And another important thing, obviously this is very much important for our Indian students, that what is the examination fee for the AAPC. So I have checked the AAPC website, and obviously you can also check that the AAPC certification is the fees is $399 for one time, and $499 if you wish that I can pass within the two attempt. So if you want that you will clear within the 2 attempt, then you need to pay $499 to the APC. And if you think like that, yes, I can do it within the 1 attempt, so you can do it with the $399. So your passing score is a 70%, and this is very much important. What are the mostly difficulties for the Indian students, that 70% passing score to achieve? So you need to do the several mock tests, you need to do the several questionnaire, that what actually came there. So human anatomy and physiology is the one of the important part in the CPC exam, as well as there is the different CPT series like the surgery, anesthesia, radiology, pathology lab, medicine, ICD-10, CM, and coding guidelines. So there are the different questions coming from the different area. So you need to be prepared with the mock examination. So after completing your 70% score, and the result you will get within the 7 to 10 days, you will get the result, and you will get the certification of the international certified coder. And within this certification, you will be recognized as an international certified coder. And another thing is that you can work anywhere in the world, and there is a huge opportunity in all over India and as well as the all over world to work for the as in CPC certified professional coder. So as you are a CPC certified professional coder, you can work in the different department, and obviously after working in the CPC, and so you will get that you should experience in the different zone. So as per that experience, you will get the work. Suppose I am experienced in radiology, so I will get the job in the radiology department as a certified professional coder. So these are the normal criteria, and there are the many students. I know that obviously ma'am started with some coding system. So what are the importance of the coding, that you should know that the purpose of the medical coding is the ensure accurate insurance reimbursement. As all of you know, I think maybe you should know about the HIPAA Act. So that is totally connected with the medical coding. So that ensures the accurate insurance reimbursement and maintains the uniform medical records, supports the healthcare analytics and the research, and ensures the compliance with the regulation. So there are the EHR, electronic health record. This is actually supporting the EHR and whatever that will help in the insurance reimbursement. And ma'am already told, I am just giving you the one just summarize. There is the coding system, ICD-10 coding, that is for the diagnosis, CPT for the procedure and the surgeries, and ACPCS, that is for the drug, equipment, and the non-physician services. So these are the coding system that actually used. And obviously, what will be the role of a medical coder? Review the patient medical records, extract the key medical information, assign the standardized codes, and ensure compliances with the coding guidelines. So these are the different things that you should work. And obviously now the last thing I want to just assure about that, what will be the medical coding salary. That is very important for the student, that what will be the medical coding salary, what they can get from here. So majorly important is that whenever you are working in India, so you can get as an official certified coder 23k to 30k. And if you are an or not an official coder, means if you have the only certificate and you have the knowledge, then you can get the 12 to 25k like that. And later, obviously later you will get when you'll be experienced, then you can get the much more salary from here. And this is the very much important is that whenever you are getting this much salary, then it will be increased day by day. But very important, you will work in a specific environment. That is very much important. Means whenever you are working in a specific zone, that will help you. But before that, you should qualify the examination. So I had one question. I have heard that the Sweta asked that from where they can prepare. Obviously there are the different academy all over the India. But the thing is that you should be knowledgeable on the human anatomy and physiology. That is actually in your 11-12 syllabus. So if you are experienced in the human anatomy and physiology, then it will be very helpful for all of you to complete this. And second thing very important, that ICT coding, that there is a different books. If you need, you can get the help from Farmers NDRA. So we will later give one announcement regarding that. So that what will be the how you can get from the ICT book and how you can prepare yourself for the ICT. But that is very important whenever you are preparing for this program. So you should know that you should pass the APC CPC examination. That is very, very much important. And also for Indian students, I know that this is very huge, that what is the examination fee. The examination fee is the $399 for the one time and the $499 for the two times. So that is huge. $399, if I can convert it into the money, so that will be nearly 32,000, and for the $499 that will be the 40,000. So that was the all about the medical coding. I think there was some problem of the ma'ams in the that meet. So if you have any question, please you can ask directly to me, and if you have any question, you can also put that in the message box. So please, students, please you can convey your question to me. Yeah, Farooq Ahmed, please.
Good evening, sir. Myself, Farooq Ahmed.
Yeah.
I would like to know that are you providing 3 months that is online and that is night class or day basis class, and what are the what are the syllabus you are going to cover in that?
Okay. So here we will cover everything, all the APC syllabus, whatever they have, but we will get you the later mail about the declaration of whatever we were covering and what will be the syllabus and everything. So if you want to know something about the medical coding, then you can ask. Later we will come about the courses and everything. So it is the just introducing with all of you about the medical coding. One question I got, that what is the medical coder? What is the qualification to be a medical coding trainer? Okay, later it will come to the medical coding trainer. What is the basic qualification for a operational medical coder? Any life science degree, that may be the BPharm, maybe the BSc, or any life science degree, they can apply for this medical coding APC CPC examination. Also, if you don't have the life science degree, you have the graduate, also you can apply for that. Just one thing very important, that you need to clear this APC CPC examination. That's all.
Hello.
Yeah, please.
Sir, when I eligible for the examination?
Yeah, I did not get your question. Yeah, please tell me that. Yeah.
When I eligible for this examination?
You can prepare for your examination during the BPharm time. So this is when you will work. Then it is very much important that you have the graduation. So before graduation also you can apply for this examination, and you can prepare for that, and you can pass this examination.
Okay, sir. Thank you.
Okay. Any question? Any more question? We will give you the answer.
Hello.
Yeah, please.
Yes. Am I audible to you?
Yeah, audible.
Yes. Good evening, sir. Yes, and my question is that at this age, my age is 32, and I have completed my B Farm degree in a few years ago. And after that, I had worked with several hospitals at hospital pharmacist.
Okay.
But at this time, there has no opening on medical coding jobs in West Bengal, because in West Bengal there has very less job opportunities. But if I will go to complete the course of medical coding, then can you provide me any, can you tell me that will you provide any jobs in West Bengal, yeah, other states?
Okay, all
Will
right.
you
I got
provide
your
me any
question.
job?
Yeah, I got your question
Yes.
that in West Bengal there are the very few opportunities. You want to share that yes, in West Bengal there are the very few opportunities, but from the last some years we can check one thing is that some companies they are working on the medical coding. They are situating in the West Bengal in Kolkata and they are operating from the Kolkata. So some students, those who have the degree of the BPharm and the BSc Life Science, they are working in there. But obviously, as there are the very less companies, regard that from the Pune or Hyderabad or the Chennai. So what happened? They are at the huge competition. For one interview, you need to visit, you need to compete with the more than 100 or 1,000 participants. So that is very hectic. But obviously, if you are, one thing is very clear, so you should, all of you need to be clear about that. If you are the certified professional coder, if you are working in any companies, certified professional coder means you have a huge requirement in the company because they need the certified professional coder. Some company they hire the graduates and they have given the time for the 1 year to be a certified professional coder, because without certified professional coder you are not able to deal with any medical electronic health records, any data. So you will be not able to do any medical data checking or anything. So you should be, before you should be a certified professional coder. After that you can apply in Kolkata. I know that last year also 2 3 companies they have done the some their placement drive. So obviously, if you are confident about the medical coding, if you have complete the medical coding APC CPC certification, then you can apply for that company. I will provide you the data of the which companies they are given or that they are everything. So you can apply for that and you can get the job. That's all.
Okay, or one thing, sir, is there any age criteria? Because every companies, private companies have their criteria. Because my age is 32, and is there any age criteria? And I have completed my B Farm, and also I have working experience on pharmacies as hospital pharmacist jobs. And but rather than I have no experience on medical coding, yeah, pharmacovigilance domain. And so if I will complete the course, then will I get any job? Because my age is 32
Yeah, yeah,
right now.
sure. Obviously, yeah. I got your question. I got your question that you want to tell about the age criteria. No, there are the no age criteria. Obviously, if you are the certified professional coder, you can join any company. And for APC examination, minimum age is 18, and after 18, you can give the examination. So as you are now 32, you can give the examination. You can join any company if you are a certified professional coder.
Okay, and I think certified professional coder is mandatory to take
Okay.
any job, to get any job. Hello.
Yes, mandatory. If you don't have, then again you need to pass that when you will join any company. I think that there should be some question like that. If
Okay.
BPharm candidate, those who have no certificate, can they join to the medical coding company? Yes, they can join the medical coding company, but they will assume like a non-certified coder. So when they will join the company, they need to do the certification and they will work. Obviously, they will work in the backstage. But when they will complete all the degrees, all the certification, then they will come to the in front of the stage of the medical coding and they can do the medical coding. Okay, thank you, Arko Prabhu. Any questions from anyone?
Yes. Thank you, sir.
Good evening, sir. Am I audible?
Yeah. Vishal, you're audible. Yeah, please tell me.
So I have one question that for how many times in a year the exam is conducted?
Yeah, cannot get your question. Can you please tell me?
So, am I audible? Hello?
Yeah. You're audible now.
So I'm asking that for how many times the exam is conducted in a year? I mean, for annually, in a year it is one time or can be conducted for two times like any some exams. I'm asking that.
Okay. You just want to tell that how many times you can give the examination? Yes,
In
for the
a
standard
year.
examination, uh, obviously you can means time is obviously depend on what registration you are doing. I told that when you will do the registration means one attempt you will get for the normal examination and two attempts you can give for the written examination, and again if you will fail then again you will get the time. So there is a no limit for the examination that you will not able to give the examination. So suppose in the first attempt you failed and second attempt also you failed and you want to try for the third one, again you can do that. So one thing is that you need to do the registration with the $399 and for the two times there is a $499. So you will get this package $499 for the two times. So if you want to give the for the fifth time also, again you need to do the registration. So there is a no lifetime limit for that.
Thank you. Thank you.
Question. Okay. If you have any question, you can put us to the WhatsApp also as well as to the email. And obviously, whatever there is a many questions regarding the course that how I can complete that. I know that that is very important. You will go towards the CPC examination. Yes, Farmer Generics is there. They will help you regarding this. And obviously, we will give you one notification so that will share with all of you. And obviously, so today we will just learn about little bit about the medical coding. There is a long pathway, so I will request everyone to be clear with the human anatomy and physiology. That is very important for the medical coding. So you can just complete that from your 11 12 books, and later the ICT coding portion you need to learn, and obviously pharmaceutics will help you regarding this. Any questions? Okay, I think all of you have completed the questions. So if you have any questions, please mail us to farmergendirex@gmail.com, or you can put us in our WhatsApp number. Thank you everyone, and thank you, ma'am. I think there are some certain issue. Actually, she is joining from the woman, so that's why maybe there are some issue. How can we do medical coding after B Pharma? So Risika have a question. Yes, how can do medical coding means how can you do the medical coding job? So I told several times that for medical coding job, somehow you need to crack the interview, and obviously one thing that you should have the CPC certification. That international certification is very much needed for that. Okay, thank you everyone. Thank you for your valuable time. Thank you everyone for joining the webinar, and we'll get the we'll announce that whatever the declaration is there about the course. So you will get that, and obviously all the best to everyone. Thank you. Okay, Subham has a question, sir. Can I use Udemy for this course? Yes, whatever you need, you can do that. Farmers India supports everyone. Whatever from when you need to gather the knowledge and you just learn and need to pass the examination. So you can use anywhere. You can do this one from anywhere. So Udemy is a good source. You can do from there, obviously. Thank you so much. Thank you for your valuable time. Thank you.